A degenerative spine disease is just a general term for arthritic changes that occur with aging along the spinal axis. So the older the patient, usually you see more and more degeneration. However, you will see more degeneration depending on what activities people do. Generally, they present with problems with nerve compression, so they can have pain along the neck or the back, depending on where this degeneration is, and it radiates along the distribution of that nerve. Along with that, they can have associated weakness, tingling, or sensory changes such as numbness or what we call dysesthesias, or kind of a hot pain. Those are all associated with nerves. They're neuropathic symptoms that are attributable to degenerative spine changes usually. For all degenerative spine disease, we first tried conservative non-surgical treatments. But if patients fail that, then surgical decompression would be the treatment, which is to take the pressure off of those nerves. There are different ways of approaching that, but generally taking the pressure off the nerve entails taking a bony or ligamentous structure, which may be compressing the nerve off and leaving it off, such as drilling it off or biting it off. When this degeneration occurs in the spine, it usually occurs asymmetrically. And as a result of that asymmetric collapse or disc height loss, which is what we refer to as that collapse, we will get a curvature that's a more lateral curvature of the spine, and that we refer to as degenerative scoliosis. The symptoms of degenerative scoliosis are similar to those of other degenerative changes in the spine. However, these patients tend to have more what I call axial pain in their back and more pain just along the back than just the radiating pain down legs or arms or what have you. These patients generally require a fusion along with decompression, meaning that once the pressure is taken off of the nerves, because of this curvature they have in the spine, in order to prevent worsening and to help with the component of back pain, these patients usually end up requiring a fusion along with the decompressive portion of the surgery. After taking the pressure off of the nerves, to actually use screws, metal screws that are placed through what are called pedicles, which connect the posterior elements of the spine to the anterior elements, and connecting these with rods to either straighten out the spine or to prevent it from worsening as far as the curvature that's already there. Traumatic spine fracture just simply means a break in the spine. The treatment can be conservative, meaning non-surgical, just like for degenerative spine conditions. But a lot of these patients do have instability of the spine, meaning that the fracture or break is severe enough where we need to stabilize their bone or the spine vertebrae so that they can heal. So it would be a similar surgery as far as the decompression goes, but usually the fixation and fusion portion of the surgery are more important in these cases. In my opinion, surgery should generally be a last resort, meaning that they have to have tried all the other modalities, be it physical therapy or pain medications or anti-inflammatories, antispasmodic medicines, etc. Once they've tried all of that and their quality of life is worsening, then I give them the option of surgery.